This is a review from class on Chapter 1 for Professional Nursing Practice from the Lewis textbook. The best evidence comes from well-designed, systematically conducted research studies found in scientific journals. And if you notice, we have scientific journals that are in the cabinets. Textbooks often become outdated by the time they're published, or it has wrong information. Like a textbook that we had before Lewis, it talked about putting the cane in the we can. Well, that just doesn't make sense. Evidence-based practice is the use of the best research, the best evidence, and it's combined with a clinician expertise. Clinical judgment is based on the nurse's clinical experience, and that's part of the evidence-based practice. But decision clinical making also should incorporate current research and research-based guidelines. Evidence from one clinical research study does not provide an adequate substantiation for interventions. We need more than one study. Nurses are concerned with the human response of an actual or potential health problem or a life process. So evaluation of patient outcomes is important, but intervention should be based on research from randomized control studies with a large number of subjects. So the nurse's role is more than administering medications, vital signs, eyes and nose, wound care. The role of nurses is promoting health. The American Nurses Association defines nursing as not only caring for the sick, but developing an individualized plan to promote and maintain health. But to expound a little bit more, other things should include use at least 2 ways to identify patients, such as a full name and date of birth. Verify telephone and verbal orders by writing down and reading back the procedures. SBAR for communication between healthcare professionals. Get information test results to the right person. Label all medicines that are not already labeled. Take extra care with patients who take anticoagulant drugs. Using soap and water and hand sanitizer before and after every patient contact. Washing your hands with soap and water is the best way to prevent infections due to a multi-drug resistant organism. Make sure to check any new medications with the patient's current medication. And give a list of patients' meds to their next caregiver and a list to the patient's regular physician before the patient goes home. Evaluate for fall risk and take actions to reduce the risk of injury. Assess patients at risk for pressure ulcers on admission and a regular basis throughout their care. Assessing for any risks that the patient is for suicide. Also assessing for risks if a patient is getting oxygen, especially if they're at home because it could be a fire hazard. When in doubt, gather more information to choose an appropriate intervention. Here we are talking about the universal precautions to be observed. The number one way to stop the spread of infections, is it hand gel? No, hand washing is the best. Now there's a difference when we talk about universal precautions and a universal protocol. Don't get these two confused. Universal precautions here, we're talking about hand washing. Universal protocol is done with pre-procedure verification, marking the procedure site, and performance of a timeout. So it's important to conduct a timeout prior to the start of any invasive or surgical procedure so that the nurse can confirm correct patient procedure and site. This is also to prevent never events, and we'll talk more about that next week. Many healthcare settings do not have a process to help the staff to adopt new evidence and practice. And nurses in practice settings lack easy access to risk management data and rely instead on tradition or convenience. The nursing process ADPI are questions new employers will ask you. The A is for assessment. During the assessment phase, the nurse gathers information about the patient. This includes physical complaints that a patient said are seen. This is necessary for nurses to take action. The nursing diagnosis requires that the nurse have a subjective assessment, and the nurse should be able to make the nursing diagnosis. It's also to measure how much the patient will need care. Planning is when the diagnosis is done. The nurse can discuss with the specialist to determine what plan of care will need to be taken. This should be done as accurately as possible to avoid mistakes at the time of treatment. Implementation. This can be implemented in various ways depending on the needs of the patient. Evaluation is after making the treatment plan, the nurse evaluates the success rate of treatments that have been implemented. Evaluation consists of determining whether the desired patient outcomes have been met and whether the nursing interventions were appropriate. Overall, the nursing process is a problem-solving tool to identify and treat patients' healthcare needs. In this slide, we see the patient's major problem is impaired skin integrity as demonstrated by the presence of a pressure ulcer. The nurse is able to treat the cause of the altered circulation and pressure by frequently repositioning the patient. And a risk for diagnosis is not the same as impaired tissue integrity. Now look at nutrition. If a patient has a fluid volume overload, how do you know that they have a positive outcome? Sometimes you have to start with the basics and think intake and output. When that is balanced, then the patient is balanced. The nursing process is a problem-solving approach to the identification and treatment of patients' problems. The primary use of the nursing process is in patient care, not to establish theory, explain nursing interventions to other healthcare professionals. It is for patient care. Now, an assessment is necessary in order to identify a problem and choose an appropriate intervention. Now remember, for NCLEX testing and for your exams, nurses cannot delegate teaching, assessment, or judgment. Assessment and patient teaching requires an RN education, and scope of practice cannot be delegated. Whenever there's a staff that's floated to another unit, they will take the most stable patient. Remember, NCLEX testing strategies. The American Nurses Association definition of nursing describes the role of nurses in promoting health. When implementing collaborative nursing actions, the nurse is responsible primarily for monitoring for complications like an acute illness or providing care to prevent or treat complications. So let's talk about collaborative. When implementing collaborative nursing actions, the nurse is responsible primarily for monitoring for complications of the acute illness or providing care to prevent or treat complications. Collaboration is the shared planning, decision-making, problem-solving, goal-setting, and assumption of responsibility by those who work together cooperatively. A dependent action would require physician order to implement. Independent nursing actions are focused on health promotion, illness prevention, and patient advocacy. These activities overlap the activities of other healthcare team members. Now, a nurse teaches a student nurse about evidence-based nursing practice guidelines. Which statement, if made by the student nurse, indicates understanding of the teaching? Well, the correct answer in this particular question is C, Charlie. Nursing care provided is based on the best evidence for quality care and desired outcome. Evidence-based practice is the use of the best evidence from research findings, quality improvement, and professional standards, clinician expertise, and patient preferences and values to support clinical decision-making. A patient has a nursing diagnosis of ineffective airway clearance related to retained secretions, excessive mucus, and ineffective cough as evidenced by adventitious breath sounds. What should the nurse include in the nursing care plan as an appropriate nursing outcome and nursing intervention for this nursing diagnosis? The correct answer here is D. Respiratory status, airway patency, and airway management. If an ineffective airway clearance is a nursing diagnosis, the outcome should be focused on airway patency with the intervention focusing on airway management. The problem identified is not associated with aspiration, poor gas exchange, or impaired ventilation.